Hello, everyone, and welcome to this live session from WHO's headquarters in Geneva. Today is a World Elder Abuse Awareness Day, and we're going to be talking with WHO's expert, Christopher Micton, who is WHO's expert on demographic change and healthy aging, about this important topic. Welcome, Christopher.
Thank you.
Christopher, could you just tell us, to introduce yourself, more about your work at WHO? What do you do?
Sure. So I joined the Demographic Change and Healthy Aging Unit about a year ago. Before that, I used to work in the Prevention of Violence Unit, where I also dealt with elder abuse. And within the Demographic Change and Healthy Aging Unit, I lead on elder abuse, on social isolation and loneliness, and I'm also responsible for data research and innovation for the Decade of Healthy Aging, which we might come to later. In relation to elder abuse, what we're trying to do at this point is to develop a strategy to address it in a more intensive and sustained way during this Decade of Healthy Aging. And to do that, we have two projects underway. The first one is really identifying the factors behind the inadequate priority of elder abuse. Elder abuse is a topic that has not received the attention it deserves over the years. And we're trying to understand why that is, and then try to address some of these factors. And the second project we're working on, which will feed into this strategy, is mapping all the evidence on elder abuse. The evidence on the magnitude of the problem, the evidence on the consequences of the problem, the magnitude on the risk and protective factors, and all the evidence on what can be done. Interventions to prevent elder abuse, detect it, and respond to it once it's occurred. The idea is to see where there's good evidence and also to identify areas where the evidence is weak, lacking altogether, so we can commission research in a more strategic and more coordinated way.
Thank you, Christopher. So today is World Elder Abuse Awareness Day. And to those viewers who just joined us now, please, you can ask your questions about this topic, hashtag AskWHO or in comments section on LinkedIn or Twitter. Christopher, I wanted to ask you a little bit more about this day. Why do we mark it? Why do we celebrate it? And since when?
Okay. I think the main reason for commemorating this day is to promote a better understanding of elder abuse, to raise awareness of elder abuse as an important human rights and public health problem that has for too long been neglected, ignored. And it's also an opportunity for the world to kind of come together and voice its opposition to elder abuse. And each year we focus on a different theme. This year it's access to justice. Last year on World Elder Abuse Awareness Day, it was the impact of COVID-19 on violence, abuse, and neglect of older persons. And since when? Well, I think the first year it was marked was 2006. And this was at the initiative of the International Network for the Prevention of Elder Abuse. And in 2011, it became recognized by the UN as an official international day that's marked every year.
Thank you, Christopher. And could you explain to us actually, what do we mean by elder abuse? What does it mean exactly when we talk about Elder Abuse Awareness Day?
Sure. I'll give you the official definition because it's quite a kind of complicated definition. Elder abuse is defined as a single or a repeated act or a lack of appropriate action occurring within any relationship where there's an expectation of trust which causes harm or distress to an older person. So it's acts or lack of acts in a relationship where there's an expectation of trust that results in harm or distress for older people, usually defined as 60 plus. And 5 types are usually distinguished, 5 different types of elder abuse. One is physical abuse, things like slapping, grabbing, pushing, or restraining an older person. Second type is psychological abuse, insulting, calling names, belittling, demeaning, and also preventing from seeing friends and family, for instance. Third is sexual abuse. A fourth is financial abuse, stealing money or possessions from the older person, or forcing or manipulating, coercing the older person into giving money, possessions, and property, and also taking power of attorney away from an older person against their will. And the last type is neglect. That really happens when an older person is not receiving the help they need from the person they usually rely on. Help, for example, for cooking, washing, bathing, eating, etc. Those are the main types. Sometimes other types are also included: abandonment, sometimes in a hospital or an institution, and in some parts of the world, accusations of witchcraft, usually against older women, sometimes in sub-Saharan Africa, and this can result in women being driven away from their homes and in certain instances even killed. So that's what we refer to as elder abuse, these 5 types in that definition.
Thank you, Christopher. That seems to be a very wide definition of what elder abuse means. And I just wanted to ask you, how much do we actually know about it? How widespread is it around the world? And how do we get data about it? Because it seems to be an issue that maybe many people don't have that much knowledge about.
Yeah, there are 2 main ways of getting data. One is official records. In some countries, you have things like adult protection services, and when an instance of elder abuse occurs, it's registered there, or it can be in police records, etc. But we know that only a very small proportion of cases of elder abuse are actually recorded in this way. The better way of getting information, or a better way of getting a sense of the magnitude of the problem, is by conducting surveys. You take a sample, ideally a representative sample in the population of older people, and you ask them whether they've experienced elder abuse in different ways, with different sub-questions, etc. And quite a few of these surveys have been done over the year, and we have, I'd say, a pretty good sense of the scope of the problem. In the community, we estimate that about 1 in 6 older people, that's 15.7% is the exact figure, experience elder abuse every year. So that's 1 in 6 older people every year. Type that happens most frequently is psychological abuse. About 12% experience psychological abuse every year, 7% financial abuse, 4% neglect, and 2% physical abuse, and just 1%, it's already obviously far too much, sexual abuse. In institutions, rates of elder abuse appear to be higher still. We have much less data in institutions, and most of this data comes from high-income countries. But the data we have suggests that about 64% of staff have committed elder abuse. And this is staff themselves admitting that they've perpetrated elder abuse in the past year. That's 64%. That's, two-thirds of staff owning up to the fact that they have perpetrated elder abuse. Most of it psychological abuse, some neglect. About 10% of staff say they've physically abused an older resident, and 0.7 sexual abuse. So that gives you some sense of the magnitude. 1 in 6 in the community, and in institutions, more. 2/3 of staff saying that they may have perpetrated elder abuse.
I must say this is quite striking to hear this data, especially about institutions. We heard a lot about institutions, elderly care institutions, amid the COVID-19 pandemic, and we obviously know that there have been issues around these institutions. Could you tell us a little bit more about the impact of the pandemic on the elder abuse issue? Do we know a little bit about what happened during the pandemic to this data, and how many people notified or said something about issues they've experienced among the elderly group?
Yeah, we're starting to have some empirical data about the increase in elder abuse since the beginning of the pandemic. Till now, there are lots of reports, lots of anecdotal evidence, a lot of reports in the press, a few small studies indicating that it had increased, but there weren't that many kind of higher quality studies. And now a few are emerging. And one in particular was published a couple months ago or so. Was it May 2021 in the US? And this is a more rigorous study. And it shows that elder abuse, this is in the community, may have increased really very significantly, almost doubled. They found that during the pandemic, and their data collection went up to April 2021, I think. So from the beginning of the pandemic till April 2021, 20% of older people in the community reported that they had experienced elder abuse. And that was an increase of 85%, not quite double, but close on pre-pandemic levels. And the increase was highest for physical abuse, a little less for others, and for physical abuse, it increased 3 times. And one of the factors that seem to account for this is financial strain. And one of the factors that seem to protect against it or reduce the risk of elder abuse during the pandemic was having a strong sense of community, a sense of social embeddedness. So definitely the prevalence of elder abuse has increased, and we're starting to get some good information suggesting that it may have increased by almost twice.
Thank you, Christopher. I wanted to just remind our viewers who are just joining us that we are talking about elder abuse. Today is World Elder Abuse Awareness Day. So please ask your questions in the comments or hashtag AskWHO. Christopher, I wanted to ask you a little bit more about what you mentioned about the institutions and abuse. We are getting comments from our viewers with some harrowing stories of what happened to their parents. And I just wanted to ask you, can we advise to our viewers what to do if they think or have a suspicion that someone in their family is experiencing issues, or are there any signs that we could think of abuse in these institutions?
I mean, of course, you can ask them. It's difficult. It's difficult. I mean, the best thing is to ask them, ask the older person concerned, and see what they how they reply. It's actually quite difficult to, on the basis of, for example, physical signs, to identify with certainty whether elder abuse has occurred. On the basis of, I don't know, cutaneous lesions, bruises, etc. And that's quite a delicate thing to be able to identify. But there are some kind of screening instruments for elder abuse, and most of them simply ask the question, have you experienced physical abuse, or have you experienced psychological abuse, and so forth. And sometimes they also, look out for signs such as a person having poor eye contact, being malnourished, sign of neglect, being particularly withdrawn, maybe having hygiene issues, cuts and bruises, and maybe being clothed inappropriately. These are some of the things that are included in these screening instruments.
Thank you, Christopher. It seems to me like some of the forms of the abuse you were mentioning earlier may not be so easily identifiable as abuse. So the conversation with the elderly members of your family, I guess, is a key element to understanding whether the abuse is happening. Yeah. And I just wanted to ask you, could you explain to our viewers a little bit more, what do we know about the impact for elderly people? What is the impact of these forms of abuse you mentioned before? So from physical to, financial and mental.
Yeah. Well, they have a devastating impact overall. And we have evidence for really very good evidence for 2 forms of consequences, and that's premature mortality. People who have experienced elder abuse are likely to die younger than people who have not experienced elder abuse. And there's, just to give an example, There's a study in the States that followed up victims of elder abuse and non-victims over a 13-year period, and people who had experienced elder abuse were twice as likely to die prematurely than non-victims. So that's a very serious consequence. Another consequence for which we have very good data is mental health problems, depression in particular. We also have evidence for a whole range of other consequences. Sometimes the evidence isn't quite as good. Of course, physical injuries, scratches, burns, broken bones, and some of these, can be disabling injuries, and they can lead to long periods of convalescence. Elder abuse can lead to physical health problems beyond the injuries, bodily pain, digestive problems, poor general health. Financial abuse can cause financial devastation that some people can never recover from, and that has, as you can imagine, a very serious psychological impact. And then it also affects family solidarity and trust. If you find out that a family member has been abusing an older member of the family, of course, that has an impact on family dynamics. It can also exacerbate pre-existing illnesses and then increase the risk that the older person is going to end up in an institution or in a hospital. And all these different consequences end up costing the health system quite a bit more money. So those are some of the kind of main impacts we have empirical data for.
Thank you, Christopher. I wanted to ask, you were talking about elderly people who are in the institutions, but there are certainly other vulnerable groups among the elderly who are even more vulnerable to abuse. Could you describe a little bit more, tell us which are the groups that are vulnerable to the abuse we mentioned?
Yeah, we have a pretty good idea of kind of the characteristics of victims, but also perpetrators that increase their risk of elder abuse. And when it comes to the characteristics of the victims, we know that an older person who is dependent or is physically disabled is at a greater risk of experiencing physical abuse. A person who's in poor physical health or has cognitive impairments or dementia are also at higher risk, and people who have poor mental health. When it comes to the characteristics of the perpetrators, we know that people who have mental health conditions are more likely to perpetrate elder abuse. People who have drug and alcohol problems are also more likely. And people who are dependent on their abuse, are either financially dependent or dependent for housing, or maybe dependent emotionally on their abuser, are more likely to abuse a person. There are also kind of factors that increase the risks that have to do with relationships. And one important factor is social isolation, and then the ensuing lack of social support. And that's been identified as an important risk for elder abuse. And social isolation is more likely sometimes to happen to older people because of these disruptive life events, like losing a spouse or a partner, or retiring, or disability, or loss of physical or mental capacity. And we know that about 20 or 30% of older people are suffering from social isolation and loneliness. So those are some of the factors. There's another factor that I can mention, and that's ageism. The stereotypes, prejudices, and discrimination against older people. And it's generally assumed that it increases the risk of older people, of elder abuse, that if you devalue, dehumanize older people, then it's more likely that they become abused, that abuse becomes more permissible. But we don't actually have that much empirical data for that, but it might well be the case. So those are some of the characteristics and groups who are at increased risk of elder abuse.
Thank you, Christopher. I wanted to ask you a question from our viewer. What to do if I witness an elderly relative being abused by a younger family member? Do you have any advice?
Well, this is delicate, right? It all depends on family dynamics, on services available, etc. But of course, you can try to intervene, try to find out more from the older person. You can maybe confront the person abusing. You could also contact services, whatever services are available in your area, social services, adult protection services, if they exist, maybe healthcare workers who work with older people and seek their advice. And there are also helplines. In many countries, there are helplines that can provide advice and put you in contact with the services available in the area. But it really depends on, family situation, the local context, etc. It's hard to give a kind of one-size-fits-all recommendation for these cases.
Yes, of course. Usually they're quite complex, but I guess what you just mentioned, it's just important to raise it and to be aware of the problem. I wanted to ask you another question we got from our viewer. What advice to give elderly with disabilities on how to avoid abuse? It's from a social worker who wanted to ask you what kind of advocacy you could use when working with elderly persons with disabilities.
Well, I mentioned some of the risk factors and maybe trying to avoid some of those if possible, like social isolation and loneliness. Try to make sure you have a number of different relationships and contacts, that will usually reduce the risk. Make sure you're in touch with relevant services. And if you have concerns, express them to the services, the healthcare workers, the social workers, whatever services are available.
Thank you, Christopher. I wanted to ask you, we got a couple questions. We talked a lot about the problem, but what are the solutions? So maybe first of all, what can be done to prevent elder abuse?
Yeah. A lot of different solutions have been tried over the years. And unfortunately, at this point, and this is one of the major gaps in the field, it's really a gap that we hope to address in coming years, is that we don't have really good evidence of what works to prevent elder abuse. There aren't many evaluations of these interventions that have shown that they really reduce elder abuse. But some of the things that have been tried to prevent elder abuse are public and professional awareness campaigns, school-based intergenerational programs, residential care policies for institutions to improve standards of care, caregiving training for people, especially with cognitive impairment and dementia. That's for the prevention. For the response, once elder abuse has happened, what are the things that have been tried? One is mandatory reporting of abuse to authorities, which takes place in quite a few countries. Self-help groups, psychological programs for abusers. So those are just some instances, but we commissioned a review a few years ago now to try to get a better sense of what might work. Given we don't have good evidence, what are the most promising interventions? And we identified 5 that seem the most promising, but still need to be more rigorously evaluated. First is helplines. We mentioned them before. They're some of the most widely used or most widely available interventions. People call, families call, or the person experiencing abuse calls, seeks advice, may be referred to services. They're usually staffed by either trained individuals or by professionals. So that's the first type that's promising. The second type of intervention that's promising are caregiver interventions. And this is really to prevent reoccurrence of abuse once it's already happened. And the basic idea here is you provide services to the overburdened, stressed caregiver to relieve some of that stress. Services such as housekeeping, meal preparation, respite care, daycare, etc. Third intervention that is promising are multidisciplinary teams. Elder abuse is a complex problem, and responding to it requires the many different services, social services, health services, maybe the criminal justice service, and so forth. And if you coordinate all these services in these multidisciplinary teams, you avoid fragmentation, and it's been shown you have better outcomes for the older person. For financial abuse, there is some evidence showing that money management programs can help. This is especially for people who have cognitive impairment or are socially isolated. And this is really daily assistance with paying your bills, paying for home care, managing your bank accounts, etc. And that's been shown to work. And then the last intervention that seems promising are emergency shelters. A little bit like on the model of shelters for women who've experienced violence. This is shelters either specifically for older people or shelters for women that also accept older women and sometimes older men. So those are possible interventions that seem hopeful.
So there are some solutions. I also wanted to ask you, for individuals like me, for example, young individuals who would like to get involved, don't experience the problem in their families or in their immediate surroundings, but want to get involved. What are the ways to get involved to keep promoting the message against elderly abuse?
It depends on the country you're in, but in many countries, there's an international network for the prevention of elder abuse. And many countries have their national networks for the prevention of elder abuse and other organizations to prevent elder abuse. So one way of contributing, getting involved, is contacting one of these national networks and seeing what you can do. There are many NGOs too, national NGOs, local NGOs, that are trying to address elder abuse. And I'm sure there are lots of possibilities for getting involved there. There are helplines too, as I just mentioned. Many of them are staffed by volunteers. So people, could call their local helpline and see if they need help. It probably requires training, etc. But that's another possibility. So there are really lots of different possibilities.
And I wanted to ask you a little bit more. You mentioned in the beginning, but for the viewers who joined us right now, what is WHO doing to prevent elderly abuse?
Well, in the past, I've just mentioned the past briefly before I go on to what we're doing now. I've already mentioned what we're doing now. So we've done a number of things over the years. We've been addressing this issue the past 20 some years, I guess. In 2002, we published something called Missing Voices. It was, I think, really well regarded, widely circulated. It was a study conducted in 8 countries trying to get at older people's views of what elder abuse is. And then in, I think, the same year, 2002, we published something called the Toronto Declaration on the Global Prevention of Elder Abuse with the International Network for the Prevention of Elder Abuse I just mentioned. And that was really a call for action to start preventing elder abuse. So you see, we've been at it for a while. We've produced a European report on elder maltreatment in 2011. And more recently, we published a number of systematic reviews trying to get at the global prevalence of elder abuse. And the figures I quoted earlier, 1 in 6 and 60-some% come 60-some% in institutions come from those systematic reviews. So that's some examples of what we've done over the years. And as I mentioned, I think it was late last year, the UN proclaimed the Decade of Healthy Aging, which goes from 2021 to 2030, and WHO is playing a central part in that. And the aim of this decade is to bring all sectors together: governments, international agencies, professionals, the private sector, for 10 years of concerted action to try to improve the lives of older people, to improve the lives of their families and communities. And we're focusing on 4 action areas: ageism, communities, developing communities that foster the ability of older people, primary care, and long-term care. And elder abuse is relevant to all 4 of these action areas in different ways. So we've decided to try to address elder abuse in a more intensive and more sustained way during this decade. And as I said, we're in the process of developing this strategy and got these projects underway that will feed into this development of this strategy, which should be ready early next year. And that will be the strategy for how to address elder abuse during the remaining, I guess it'll be 8-9 years of the decade.
Christopher, I wanted to ask you a little bit of a personal question because we're getting some questions about which country has most abuse or by gender. And you mentioned before on the data that it's not so easy. So I wanted to ask you, what is the biggest challenge of working in this area for you?
Three things. First, it's a pretty gruesome and depressing problem, right? Older people who are often experiencing other problems, health problems, problems of social isolation, having to cope with this on top of everything else. So you know, it's not a pleasant problem to deal with. Second issue is the lack of attention. I mean, as I said, this issue really came to prominence, I guess, in the late 90s, a little bit before that, but greater prominence in the late 90s. WHO has been dealing with it for 20-some years. In spite of all of that, in spite of the fact that we have World Elder Abuse Awareness Day, which is important and really focuses people's attention on this, in spite of all that, this issue is not getting the attention it deserves. And that's one of the challenges. And related to that is the fact that we have a real lack of evidence in certain areas. We have some sense, as I said, of the magnitude of the problem, but when it comes to which solutions actually work, we know far too little. And we can't really address this problem effectively until we have a better sense of what works, so we can start implementing it and scaling it up.
And Christopher, do you have a sense that elder abuse is a bit of a taboo topic for some societies?
Yes. I think not for some societies, probably for most societies. I mentioned we're doing this research on the factors behind the inadequate global priority of elder abuse, and we've done a whole series of interviews with experts, and that's something that keeps coming up. That elder abuse is something of a taboo. People don't want to talk about it. People are ashamed. You know, people experiencing it are ashamed and very reluctant to admit it. Families in which it's occurring are also reluctant to face up to it, to deal with it. But policymakers, people, you know, even in the area of aging, are somewhat reluctant to address this issue. I think it's a difficult issue. I mean, as I said, it's a distressing issue. It's a kind of tragic issue. And it's kind of a gruesome issue in certain cases. And I think people find it difficult to deal with. So it definitely is something of a taboo.
Thank you, Christopher. I wanted to ask you to remind our viewers the name of the International Network Against Elder Abuse, because some people got interested and maybe want to get involved. So if you could just mention that name again.
Sure, and they have a website. Just put the name in Google, and the name is the International Network for the Prevention of Elder Abuse. And the acronym is INPEA. Actually, I think if you just put INPEA, you get to their site, INPEA.
Thank you very much, Christopher. Maybe to end our discussion today, I wanted to ask you a little bit about the way forward. So you mentioned that there are some actions planned for the nearest future for the World Elder Abuse Prevention Day. Could you elaborate a little bit about what is WHO planning in the future in terms of preventing elderly abuse?
Well, we have these two projects. They're going to feed into a strategy. So I don't want to kind of prejudge the strategy. But I think there will be a number of things that will be important to address. One is increasing the awareness of this problem, kind of globally, nationally, etc. I mean, as I said, World Elder Abuse Awareness Day is very helpful, but we have to increase the awareness beyond that. And that will be definitely one part of the strategy. A second part is getting more funds for this issue. This is an underfunded issue. I know many issues in public health are underfunded, but this is a particularly underfunded issue. So trying to raise more funds. And I think a third part of the strategy will be trying to develop interventions that are more effective. I mentioned a few times that really is a gap in our evidence. So I think focusing on that will be of paramount importance. So those are at least three areas which I think the strategy is going to have to address.
Thank you so much, Christopher, and thank you for your important work. For those viewers who joined us, thank you for watching. We had viewers from India, Oman, USA, Zambia, France, DRC, Kenya, Nigeria, Nepal, Bahrain, and many, many other countries. Thank you so much, Christopher. This was a conversation about World Elder Abuse Day, which is today. And till the next time.
Thank you, and thank you everyone for listening in. Thanks. Bye-bye.
Thank you. Goodbye.